My name is Caitlin Rausch. I'm a pharmacist in the leukemia department at MD Anderson Cancer Center. And today we are discussing the results of our research looking at the combination of ivosidenib for patients receiving it who have AML or high-risk MDS, while they're also receiving azole antifungals, including voriconazole and posaconazole. So we did a retrospective review of patients who were receiving treatment with ivosidenib in combination with these azole antifungals. The reason for this, what spurred this research to begin with, is that ivosidenib has a number of drug interactions that are not highlighted very often, or something that we didn't initially think about when first starting to use this medication. But it does have significant interactions with a lot of other medications because it actually reduces the amount of other medications, or can reduce the amount of other medications in the body based on the metabolism. So it actually can increase the metabolism of medications such as posaconazole and voriconazole, which are antifungal medications typically used in these patients. So we anecdotally we're seeing low levels of antifungals, particularly voriconazole, in these patients when we were beginning to use ivosidenib. So we wanted to look more closely to see if there was a true interaction, or this was just something that was seen anecdotally. So we retrospectively reviewed azole levels of voriconazole and posaconazole in 31 different patients who were receiving ivosidenib at the same time as their azole. Among those 31 patients, we had 78 levels that we looked at. We were able to compare levels when patients were not on ivosidenib versus when they were. And what we found was that when patients were receiving concomitant ivosidenib, that a significant number of them had reduced levels of voriconazole as well as posaconazole. So interestingly, many of the voriconazole levels were actually undetectable, which is something that we don't often see in clinical practice. We may see, a low level for which we need to increase the dose, but undetectable was something that was a significant takeaway from this evaluation. So we saw that 47% of our posaconazole levels were considered subtherapeutic, and 77% of our voriconazole levels were considered subtherapeutic. And the number of subtherapeutic levels while on ivosidenib was significantly more than when patients were off of ivosidenib. So from this, we have concluded that typically, if you're wanting to use an antifungal while the patient is receiving ivosidenib, that you should probably avoid voriconazole because so many of our patients had undetectable or low levels, and that posaconazole would be the preferred agent in this setting. But even still, many of our patients required higher dose posaconazole. So frequently monitoring patients' serum levels of their azole while they're on ivosidenib is also definitely warranted to make sure that you're achieving adequate levels for either prevention of infection or treatment.